Good morning. My name is Brian Wheeler, Director of Communications for the City of Charlottesville. Welcome to Cville360, a program to inform and engage the Charlottesville community. Cville360 is available on our streaming sites, Comcast Channel 10, and on a companion Zoom webinar, so you can tune in live and on demand while practicing social distancing. Over the past 3 months, we've used this program to engage our community and provide access to city leaders. We've also shared information about the coronavirus pandemic and the city's response. We use the Zoom webinar so you can join the broadcast and ask questions of our guest. If you want to try the webinar, visit charlottesville.gov/Zoom for the registration information. A link to each show appears at the bottom of the page. When we take questions today, we will allow up to 8 people to address our guest, and you have up to 3 minutes to ask a question or make a comment on the topic being discussed. Today's show is a check-in on the state of the coronavirus in our region with Ryan McKay, Senior Policy Analyst with the Thomas Jefferson Health District, who joins us today in studio. Ryan, welcome. Appreciate you coming down. And the timing seemed right for this conversation. I've been saying that for several weeks, but every week it seems like it's more and more important.
Yes,
so,
thank you, Brian, for having me. And I don't know, maybe there's never a wrong time to talk about coronavirus and where we are currently. The timing is right. We're almost a full week into phase 3.
Yep.
Lots of questions about what that looks like, what our numbers are, and what the future really holds. Lots of news stories and questions about schools coming up, whether it's University of Virginia with students returning or private and public schools reopening in August and September.
And when you watch the national news, I mean, there's some alarming trends around the country. And in those states that have done reopenings, in particular Florida, Texas, California, what we're seeing is record numbers of new cases and hospitalizations. So, I think unlike other developed countries, we are not flattening the curve the way we thought we would be.
That's 100% correct. We are not doing the things as a country to put ourselves in position to reopen appropriately in terms of public health. You mentioned Florida and Texas, Arizona. There are other states that reopened a little bit more quickly than we did here in Virginia. And what we're finding is that a lot of the activities that reopened, larger events, indoor events, bars and restaurants operating indoors, have led to significant spikes, not only in cases, but also in hospitalizations. Rates in Texas and Florida are really high. ICU capacity in Texas in the larger areas, the urban areas, Houston, for example, is either near or at capacity. And so we're seeing in those states what we saw in the Northeast very early on.
Sure.
And I would say we're still in that first wave. We really haven't left it because while we did see a decline in like daily cases and hospitalization rates, we didn't truly flatten the curve. We sort of slowed things a bit, but reopening quickly has left us vulnerable as a country to rapid increase in cases.
And, Dr. Anthony Fauci, was quoted this week as saying, we're still knee deep in this first wave. And, 4 months in, is this where you thought we would be?
As a country, I don't think so.
Yeah.
I thought we'd be further along. We see examples across the world, particularly in Europe. New Zealand, I think, went a stretch where they didn't have any cases. So those countries have done it very well. They've taken their time to reopen, and they're really in a good position in Northern Europe and in Finland, Norway. They've reopened schools, and they haven't actually seen significant increases in cases. So what that means is they put themselves in position to get there, to be able to reopen schools with some strong confidence that they could manage outbreaks accordingly. And we're just not at that point as a country. Individual states are doing better, depending on where you're looking. But right now, we'd love to see, as a country, all of those cases start to decline again.
And before we dial into the local data, which we're going to put up on the screen and let people also ask us questions about it, as the Commonwealth, Virginia is not like the majority of states right now that are seeing the spike. I mean, what do you attribute that to?
The Commonwealth has done a great job, both in terms of our policies, but also as a communities, to really adhere to the guidance, the mandates, the regulations. So face coverings has been really important. Closing and then reopening businesses at a slower pace than the other states, I think, has been tremendously helpful. We've been able to really bring down the numbers across the Commonwealth. And I think, prior to phase 3, we saw an uptick, not just locally, but across the state, and that's trending back downwards. And I think that one, we're going to see that. There's going to be ebbs and flows, peaks and valleys. But really, we figured out how we can appropriately reopen without overwhelming our systems, without creating huge spikes in cases. And I think it's going to be sort of that adjustment as we continue to move forward of making sure that there's the reminders about face coverings, social distancing. It's a little early to tell how well phase 3 is going. We need maybe a month and a half to really see that, transpire. But we're heading in the right direction again, and I feel good about where we are this week. Not as good as where we were last week, but we're improving, which is great.
Great. So we are going to take audience questions, and you'll be able to click the raise hand icon within the Zoom webinar. I'll call on people in the order in which they raise their hands. You can also type a question in the Q&A module, and I'll be happy to ask that of Ryan McKay. So let's look at some local data here, and I'm going to pull it up on the screen and share this with the audience, and then we'll let Ryan talk about it. So let me switch to the data portal. So this is on the Virginia Department of Health website, in particular the Thomas Jefferson Health District's portal. And this is data that you update daily now. And
yeah, it's updated daily by 10 a.m. So those new cases are things that we've confirmed and notified confirmed in our surveillance system. So 11 confirmed as of this morning at 10 a.m. You can see the total cases. Now that goes all the way back to our first case confirmation. I believe it's March 20th. So we did cross the 1,000 case threshold, but that's not necessarily representative of active cases right now, which is a difficult number to determine. Total hospitalizations over that time is 101. We have seen an increase in fatalities of 10 over the last week or so. And I just want to add that for fatalities, those aren't necessarily reported as they happen. We have to go through the confirmation to do that. So sometimes there's going to be a lag. I think in June, when Joe Powers was on, similar situation where we'd seen a pretty sizable increase given the numbers we have, and it's attributable to just the lag in fatality reporting.
And you've got the different localities in the bar graph right below that big graph. Remind folks which localities are in the Thomas Jefferson Health District.
So we have Albemarle County, the city of Charlottesville, Fluvanna County, Greene, Louisa, and Nelson counties is the area that we serve in our health district. And you can see the Charlottesville numbers there are in orange.
Yep, so we're 239 cases in the city of Charlottesville and 472 cases in Albemarle County. And I remember when this data was first being discussed, there was a lot of interest in race and ethnicity and having that breakout. What are we seeing in that data right now?
That's a hugely important piece, because what we found, not just in our health district, but across the state and across the country, is that Blacks and African Americans, and then people in the Latinx and Hispanic communities, are disproportionately getting positive cases, are disproportionately hospitalized compared to their overall percentage of the population. And as you can see, I believe we're almost at 35% of cases are Hispanic or Latinx. And that's hugely important to understand, because that allows us to really look into why is that happening, what historically has created that, and what are the things that we can do to support that community. And so we're really looking not just within our district, but within the state to figure out what are going to be the best options to make sure that we're providing the right resources in that sense.
I'm going to scroll down to the bottom of the page and have you talk about this graph related to testing.
So the big number there, 21,645, that's the number of testing encounters we've had for the entire 3-4 months that we've been doing this. That number is important because it demonstrates, one, our access and how many of our population we're actually testing. I think we're ranked in either the top 10 or 11 in the Commonwealth in terms of the number of tests we've done, largely due to our partnerships with Sentara Martha Jefferson and the University of Virginia Health. The number on the right is 5.8%. That's our positivity rate for PCR tests. These are the tests that we do to confirm whether at that given moment an individual does or does not have COVID-19. 5.8%, this is actually down almost 2 full percentage points from about the same time last week. And we want to see that number decrease. So even though we may see an increase in the total number of cases that we're finding every day, if that number is going down, that's the improvement we're looking for. We want to get that number down as low as we can so that transmission is happening less frequently. We can quickly identify those hotspots or clusters or new cases that emerge and work with their contacts to make sure that they're quarantined so that we minimize that spread. I don't know what the state number is today. It was 6.1% yesterday. So as a state, and particularly in the district, you can see we had a pretty high peak last week, and we've really done well to bring that back down. It's hard to say why that is. We don't know, if this is related to different testing events and where they occurred, if there were point prevalence surveys in some of our long-term care facilities where they had maybe additional cases we didn't anticipate. But what we're seeing in the trend of downward positivity rates is promising, and it's helping us feel a little more confident about entering phase 3 this week.
And what might that number be like in these hot spots around the country by comparison?
It could be in the 20s. I think Texas or Arizona was in the mid-20s at one point. Florida is creeping up towards 20. I think the goal is for states and localities to be around the 10% or lower. So the further we get down, the less likely it is we're going to have just huge spikes in cases over time.
And we're building a scorecard that we look at as far as our reopening efforts and the transition in these different phases. But what are those key metrics? I mean, you talked about this positivity rate. You look at that over a 2-week period. There's also hospitalizations and then the number of new cases. Which way are we trending on those things?
So in terms of the positivity rate, we are trending down. We did see some high peaks last week. Average number of daily cases has increased a bit. That's not to be unexpected. I think the more we're providing testing, the more cases we're going to find. And while we don't necessarily want an increase in number of cases, that actually has a silver lining. We can quickly identify those cases. We can get those individuals isolated and then make the contact tracing work to inform people they've been exposed and give them instructions and guidance on how to protect others and themselves during a 14-day quarantine period where they shouldn't have contact with people outside of their home.
Great. And the hospitalizations, how's that been trending?
Hospitalizations have trended up a little bit in the last couple of weeks. The thing about hospitalizations is that those numbers are going to lag a bit behind the case numbers. So if we saw cases increase or percent positivity increase over the last month, those cases aren't necessarily going to need hospitalization at the moment we confirm testing. It's going to be a week or two before they get to a point where they need oxygen or they need that support. So hospitalization numbers are going to lag a little bit behind because those cases just aren't developing, severe symptoms early in their onset. It happens a little bit later. I think statewide we feel good about where we are. ICU bed capacity across the state is still strong. Ventilators across the state are still strong. I think last I checked we were about 21 or 22% usage, which is good. I think the thing to remember too about our local hospitals is that they're not just serving our health district or the Charlottesville-Albemarle area. They're going to serve across the state potentially, so they have wide catchment areas.
And UVA will even bring in from out of state.
Yeah, I'm sure they're doing that already. It's just something that naturally occurs given the quality that they provide in terms of healthcare.
But locally, our ICU bed capacity, we're in good shape right now.
I think we're in good shape right now. We're going to look at all of this data very closely as we move into phase 3. We want to make sure that we're ahead of it. We're reviewing our current scorecard measures to make sure they're the appropriate ones, that they're actionable data elements, so that if we see a trend, we can make decisions about what to do to reverse those trends.
Let's check in with our audience and see if you have any questions. You can click the raise hand icon and I'll bring you onto the program to ask Ryan McKay a question. And you can just click that icon or you can type a question in the Q&A module and I'll be happy to ask it for you. I do have lots of questions if you don't, so don't you worry. One of the things I want to ask you about is testing capacity, turnaround time, and then the contact tracing. So let's start with testing capacity. I mean, I know we're having lots of events where people can go and get tested. What are some reasons, one, you would want to go get tested?
You would want to get tested if you have COVID-like symptoms, fever, fatigue, aches and pains that you haven't normally experienced, if you've had a sudden loss of taste or smell. Those are the things that would maybe prompt you to go get tested. The other is if you've been exposed, you've been exposed to someone who has COVID. So if you've been contacted by the health department as part of a contact tracing or case investigation process, if you live with someone who has tested positive for COVID and then after a few days you start to develop those symptoms, that's an appropriate time to go get tested. In our events, we're testing anyone who wants to get tested. We're not limiting that. But if you're really thinking about when is the right time, those are some good reasons to go get tested.
And early on, you had to be symptomatic to get the test because there was limited supply of the testing.
Yeah, nationally in our health district across the Commonwealth, we really had limited supplies, and the criteria was you had to be symptomatic with those COVID-like symptoms, and then we would ask you some questions about that before facilitating access to testing. Capacity has increased. We've been able to provide lots of people with free access either through our events or through other means to get tested. What we are seeing, though, because there are increased demands for testing nationally, it's created some delays with the national labs, with CVS, who is doing testing locally. And so maybe we would have expected 4 to 5 day turnarounds with some of the commercial labs. It's taking a little bit longer, maybe 7 days, 8 days.
Okay.
And so that's something to consider, and a metric we may look at later on as we open up in phase 3 is what's the capacity to test? How long is it taking? If we continue to see an increase across the country, does that change things for us locally?
So phase 3, so the Commonwealth, the governor had phase 3 start July 1, I believe.
Yes.
And, one of the issues there is, social gatherings. And we moved from, I think it was 50 people in phase 2 to up to 250 in phase 3. And so that might be, 50% occupancy or 250 people, whichever is less. But is that a safe environment from your perspective that you want to be in?
I think the environments that we want to be in are ones where we can understand and manage the risk. Just because it's 250 people doesn't mean we actually have to do that. Indoor events seem to be where things are creating the opportunity for super spreading, where maybe 1 or 2 people can expose an entire room of people. So if it's an indoor event and there's lots of people, under 250, are people wearing face coverings? Is there the opportunity to socially and physically distance 6 feet apart? Just because we're wearing a face covering doesn't mean that you can be within 6 feet for more than 10 to 15 minutes and eliminate risk. We still want to maintain that distance. We want to wear those face coverings. So it'll be situational, but you have to sort of measure the risk. Outdoor events are going to be much safer. What we're finding is that disease spread outside is far less likely than disease spread inside. Yep. I would still recommend wearing face coverings if you're outside and you cannot be 6 feet apart. I think still that's important. So if you're having, a barbecue with family members for the first time since who knows when, can you socially distance on a deck or outside? I think that's really important to understand that disease can still spread outside. There's things that we can do to sort of measure the risk. And I think people will assume different levels of comfort with risk, whether that's going inside to eat at a restaurant or eating outside, going to a birthday party that's inside versus outside. We should be measured about that and understand that there are risks involved and that people who are asymptomatic can spread disease, which is why we want people to wear the face coverings.
Yep. So the face covering is still important. And basically, it's a sign of respect for your fellow humans that you're taking care of yourself and not trying to spread the virus if you have it.
Right. But we talked about this very early on, especially related to people in long-term care facilities, older populations, where protecting yourself and was really about protecting others. That washing hands, staying at home, wearing the face coverings wasn't as much about you as an individual. It's about your role in how disease spreads. Yep. And that's really important as we move forward. I think individuals still need to take those precautions, because if we want to be late August and September reopening schools, minimizing risk, now is the time to get to that point. If we stop using the face coverings, if we stop social distancing, if we stop washing our hands, that's going to increase risk, potentially the number of cases and positivity rate. And we want that rate as low as we can get it before schools open, so that we feel more comfortable about having children going back to school. Teachers can feel safer being in the classroom. And we as a community are at a good point that we can continue to reopen the economy. But to do that, we have to be vigilant now to get there in 6 to 8 weeks.
We don't want to have to roll back, and what these other states are now doing. They went a little too far. They're now having to take those businesses back to a previous point.
Yeah, and it's going to make that much harder. It was hard to do the first time. It'll be extremely hard to go backwards. And so a face covering is a small act by an individual to support the whole community in moving forward.
And does the health department have a role in enforcing that? I mean, are you flagging people down as you walk down the downtown mall and issuing citations? How does this work, Ryan?
No, we're not flagging people down. We do get a lot of complaints. Those complaints generally go to the Virginia Department of Health in Richmond. And then weekly they're going to send us the complaints in a file. And then we'll follow up with those complaints that are really specific to restaurants, because that falls within our regulatory mandate. We may visit some grocery stores or make some phone calls, but we can also send those to the Virginia Department of Agriculture and Consumer Services, because they're the ones who license grocery stores. Our goal is to educate. There's lots of guidelines. In some of them, there's a little bit of vagueness, depending on the industry that we're talking about. When it comes to face coverings, we want to educate. We want to provide people with tools, especially businesses, to help enforce that within their own business. And set an example for the community. So if employees are fully masked, if they're taking the measures to reduce risk on their own, that's a good model for the rest of the community. We don't want to give citations. That's not helpful. That just creates, I think, resistance to what we're trying to accomplish. We want to make sure people understand the importance, the why. The why is we want to reopen safely. This is one of those things that each individual can do to get us there.
And I think every business I've been in, whether it's food service or hardware store, you name it, that there's a sign on the door. It says you must wear a face mask as you come in, and people are doing that as customers. So I've been pleased to see that at least in those environments, people are following those rules.
I think for the most part, people are. We get the complaints, and I don't have the total numbers, but it's not overwhelming. And I think that reminders about the face coverings is important. And I agree. I'm seeing the vast majority of people wearing face coverings, employees especially, inside businesses.
I know schools are something people may have questions about. If you want to ask a question of Ryan McKay, just click the raise hand icon in the Zoom webinar. You can still join us in Zoom by going to charlottesville.gov/Zoom. You can quickly register and join the program that way, so you can ask a question. Nobody has raised their hand at this point. I do have some questions in the Q&A module, and I will look at those in just a moment. One of the things I want to go back to on the testing was contact tracing. And I know there was an initiative to hire a lot of people throughout Virginia to help the health department do that work. Tell us why that's important, and where are you with the resources?
So the contact tracing is important because once we investigate a case that we get, so we get a lab report dumped into our system on a daily basis, and actually it occurs multiple times a day. And what we do is we contact the individual who got tested, and we walk through, where have you been? Who have you been in contact with? Do you have names and contact information, so that we can talk to those individuals about what their potential risk is? And we ask lots of questions. It's not a very necessarily always a quick process, but we want to make sure that we're providing people with what level of risk they have, so we can give them the appropriate instructions. The contact tracing identifies someone who was exposed to someone who confirmed with a positive case of COVID. We ask some of those follow-up questions again, just to make sure that we're understanding of the potential risk. For people that are truly at risk, we'll give them guidance on quarantining for 14 days. What should they be doing on a daily basis? What symptoms should they check for? We use a Sarah Alert program that allows them to just keep us posted on their symptoms. If those individuals get through the 14-day process without any symptoms, they're welcome to go back to work, to school. They're outside of the period that we would expect them to get sick. That tracing is important because if we can keep people who were exposed from going outside and interacting with others, it eliminates that risk of exposing others, even if you're asymptomatic. And that's really how we're going to continue to get a downward trend. Are we isolating people quickly enough? And are we contacting those individuals quickly enough to get them quarantined? I think we're in a great shape for that we're in the high 90s in terms of percentage of people we're contacting within 24 hours, which is the key, so that we're eliminating any risk of exposure for others who haven't been exposed, knowingly been exposed to that point.
Okay. We have a question from a friend of the program who wants to know about how the delay in testing results, so you said it might take a week to get the answer back. How does that impact the data? So if you're updating your data every day and saying, here are the number of people tested, but there's this lag in getting the results of that test, how does that work in the data, if you know the answer?
So we do get, the lab reports come in, and I think on the VDH website and even our own, there's sort of a gray area where that grayish area would indicate those numbers could change. It's hard to accommodate for that. We have to make decisions based on the data we have, understanding that there's going to be potential for increases down the road because that delay is occurring. That's why we really look at trends. What's the trend over a week, over 14 days, as opposed to a single day trend? And I think we have enough data now to indicate week to week or every other week that we're trending in the right direction. So it does give us pause on a day-to-day basis when maybe lab reports come in a week late, they've sort of bunched up and then we get a big number. But we really want to look at the trend, what's happening over longer periods of time to demonstrate true trends in disease spread.
Great. We have a couple other questions on testing. Carrie Elwood wants to know, with UVA students returning or public schools opening, is that going to impact testing supplies available, and how will that impact turnaround time?
Well, thank you for that question, Carrie. So testing across the country has increased. Obviously, if we're increasing demand or increasing the number of cases, more people will be tested. We, as a state, are working hard to make sure that all of our state and local agencies have the appropriate capacity, the supplies to do testing. Our partners who are doing testing on their own, UVA Health, Jefferson, all of the primary care providers, certainly working internally and then with commercial labs to make sure there's capacity. That is a very critical thing that we will continue to look at throughout the summer and into the fall as schools reopen, as students return for the University of Virginia. Our ability to identify and isolate cases is directly correlated to the availability of testing supplies.
And we have a question from Craig Schneiders, who asks about, he points out that early data on the test kits, there was more maybe false positives than we wanted in the testing equipment and materials. So what's being done locally to improve test accuracy, or globally for that matter?
Interesting question. I don't know if I have a great answer for that. I think what we've seen is that the reliability of the tests has improved greatly over the last several months, and we feel much more confident about the results now than we did before. I think where we're still learning is sort of the antibody testing, which really determines whether you've had COVID or not whether or not you have it right now. That technology, those insights and studies are still ongoing. But specifically to your point, Craig, we're really confident where we are with the PCR tests that determine whether or not you have COVID at that moment.
So let's talk about schools.
Yes.
Have you been working with city and county schools as they make their plans?
Yes, we've been in contact with city and county schools, with private schools, and schools throughout the district on their plans. They ask us very challenging and specific questions, reviewing plans, making sure that we're providing them with up-to-date information from VDH and from the CDC. And they're working hard to make sure that they're accounting for all of the different facets. It's an enormously challenged proposition to reopen schools. And what I've been impressed with is the level of detail they provided in their questions and their plans, thinking through different ways that they can be better about safety, about communication, during the reopening piece. One thing we're really looking at is when cases emerge in a school setting, what's the process? What's the protocol? How do we minimize risk? And I think for us in public health, it's really working with them individually as schools to make sure our process is in place, but also what does that look like in practice? And how do we work to keep people safe, teachers, staff, students, but also keep schools open? And that's really challenging, and we're really trying to work through those processes now.
And you talked about staff, and staff may be the more vulnerable population in a school. So we've heard that there have been petitions and letters written to our local school boards with staff really concerned about whether they should be doing instruction in person or not. I mean, how have those conversations gone that you're aware of?
They're difficult. I think for every question that's asked, there's probably 4 or 5 questions that follow up to that we need more information on. It's really critical, especially in younger children, to get them back. That social connection that children need, socialization, being with friends. As a parent whose wife is home every day with a son who's 5, there are a lot of challenges that have come up, and I think some of those are directly related to not having that routine of school.
Right.
And so I think we're really trying to figure out what's going to be the best way to open schools safely, particularly for those younger groups. There's nothing better than in-person instruction. Obviously, high school students are better able to handle the online, but there is that component that you just can't replace being in a school setting. And so we're really trying to figure out what that's going to look like. And the American Academy of Pediatricians, I think that order is right, has released some new guidance. And we're really looking at both at a state level, but at a local level, and how to implement that and make things safe for children, but also for teachers. And I think there's a concern there that adults are going to be at higher risk than children. The data just points towards that. And so how can we help teachers protect themselves? How can we help staff protect themselves and feel comfortable going in to a situation where they need to be 100% thinking about education and children? And I think if teachers don't feel comfortable, if staff don't feel comfortable, it makes that job that much harder.
And all businesses are facing these challenges and trying to address workplace safety issues. I think about the city of Charlottesville, and comparing that to a school complex, it's much different. I can think about how my staff can keep themselves 6 feet apart, wear face masks, and think about our public interactions, and that can be really contained and done in a thoughtful way. I can't imagine a 5-year-olds running around and trying to think about how to maintain that distance. But as you said, they're there for, in part, social interaction. They're there to be in the cafeteria, to be on the playground. Those are all really challenging environments and questions.
They are. I think one thing we would like to see, and I don't know how well this has been communicated to parents, is that now is a great time, speaking of doing things now, to educate children about face coverings, who can wear them. Not all children are going to be able to do it, and certainly not all children are going to be able to do it all day, even if they can. And so how do we help our children understand what they're going into? If we're talking about 6 feet of social distancing, practicing that now with neighbors in the community and children is going to be really important. What does that mean? Why are we doing it? Having those conversations. I think there are a number of resources online that can help parents begin to talk to their children about these things. The ability to open schools and keep them open there's a whole gamut of things that have to be addressed, from the parents and the guardians who are doing symptom checks before the child gets on the bus or goes into a building, to teachers and bus drivers and aides, making sure that we can keep children as socially distanced as we can, but also understanding that there's just not going to be 100% foolproof of doing that. And then the schools and the systems having plans in place to quickly address symptoms as they emerge. It's a whole system, it's a whole process, and we all have our part in that. And I think now is the time, both as administrators, as public health, and as parents and guardians in the community, to really think about what that's going to be come August and September, and what can we do now to prepare our children as much as we can when schools open.
Yep. Well, as a parent and former school board member, I want to make sure to thank our educators for all the work they're doing, figuring this out, trying to figure out online instruction, and how to do this in this new world of a pandemic. It's going to be tough work.
My first job out of college was teaching. I'm not sure how I would do that now, just given some of the limitations. Not everyone has great access to internet. Not everybody has the technology to do online training. So teachers have an impossible job sometimes as it is, and this only adds to that effort. So yes, their actions now are to be applauded at this point.
Yep. So if you have questions, you can click the raise hand icon in the Zoom webinar, and I'll bring you into the conversation. We're getting a couple questions that my staff are monitoring on Facebook. And Andrew Towns, if you want to ask your question, I need a little more detail about which events you're interested in, whether that was events that people might go to, or whether it's testing events that might be offered in the community. I'd be happy to ask that question. If you put it up again on Facebook, my staff can get it into the webinar for you. This, I know you aren't going to know the answer to this. How long is this going to be our new normal? I mean, when we think about what it will take to have a vaccine and to have that widespread, deployed throughout the nation, 2 months ago we were talking about it's all about mitigation, flattening the curve. Clearly, as we look around the country, that's not happening. Dr. Fauci is saying, we're still in the riding the wave right now. What do you think about as far as timeline for this pandemic?
As far as vaccine, I think timeline, what we're hearing is potentially something available, not widespread, but available late fall, early winter, so really November, December. January, possibly available to the larger community. I think we have to understand about vaccines is that depending on the vaccine type, it's not 100% effective. The MMR, which is measles, mumps, rubella, is about 97%, which is incredible and needed. Measles is highly contagious. Flu is 40%. On a good year, it's 50% effective. And really what flu vaccine does is it reduces the likelihood that you're going to need primary care physician to provide antivirals, hospitalization. It doesn't necessarily prevent flu. And I think we have to sort of tailor our expectations about the coronavirus vaccine, whatever that looks like, that we will be able to minimize risk, but I don't know that we're going to be able to eliminate risk. It's going to be very different. What the world looks like in 12 months, I think, given what we've seen across the world and how they've done a better job as countries in the developed world to reduce spread, to minimize risk and exposure, there's light at the end of the tunnel. There is hope. We have to use those things throughout. So whether it's vaccination or there's a term herd immunity, which means lots of people have been exposed and developed their own antibodies, I foresee that things like face coverings, how we interact with people to reduce spread, is going to be a constant, even when a vaccine is here.
Yeah.
I think countries in Asia, given their experience with SARS in 2003, MERS in 5-6 years ago, and other influenza events, they've really prepared for that. And so wearing a surgical mask is not uncommon, and that might be part of the new normal, that specifically people who are high risk, wearing face coverings more often.
Well, we have a question from Facebook from Lori, who talks about she lives in a condominium building, 170 people in that building, and there are lots of public areas, lobby, laundry room, elevators, hallways, and there's signs up to say you have to wear a face mask, but she says many of her fellow residents are not. I know the health district is responsible for restaurants and compliance there. What about in residential facilities? Is there a path for people to register a complaint?
Lori, that's a great question. We'll take and log any complaints. I think how we follow up is going to be dependent on who the management company is, what guidance we get from the Virginia Department of Health. But we want to be able to help residents understand through education why it's important, particularly in those settings, high traffic areas, elevators, lobbies, hallways, and what that really means, so that we can help people understand risk, understand how the disease is spread, and why things like face coverings are really critical, especially indoors. The super spreader events that I mentioned earlier are places where people have gathered in close settings without face coverings, maybe some with face coverings, where we're really generating potentially lots of droplets where we're going to expose people. So if you file the complaint, that allows Virginia Department of Health and us as a health district to understand where they're coming from and figure out strategies and how we can help individuals and help management companies really communicate the importance of face coverings in these environments.
And hopefully over time this just becomes our, as you said, our new normal, and people are just more accustomed to it and accepting of it. And it's really unfortunate that it's become politicized right now in the landscape of this national presidential election and the whole face coverings issue. So hopefully we get beyond that. I want to bring another question forward from Facebook. This is Christina, who's a public school parent, and she's got more of a statement, but her statement of concern is that the school division is going to put all these resources into reopening in some fashion, and then they may have to roll that back as the virus spreads again. So I guess a question I've got related to that is the seasonality of flu and coronavirus. What do we know about this particular virus at this point, and the chance? What do we expect to have happen during hot months in the summer versus when we hit fall?
It's a really interesting question. So flu season ebbs and flows with the seasons. As it gets warmer, we see less flu. It's still there, but it's far less likely to get flu in the summer as it is in the winter, even indoors. I think with coronavirus, what we're experiencing, Florida's been warm for months, and they're peaking right now. They're in Texas, it's the same. So what we know is that, outdoors probably safer, still potential for exposure and spread. Indoors is really the critical piece to that. And that obviously raises lots of questions for the fall and the winter when flu season does come around. So I think outdoor events are going to be better in the summertime, even in the winter. I think it's going to be, a little bit better to be outside than inside, which is challenging, obviously. But seasonality, I think, isn't going to impact spread for coronavirus as much as it does for flu. We're just seeing too much transmission in spots in the country, again, Florida, that's been warm and hot for a couple of months now. I think understanding what that risk is, how we can prevent that. So I think Texas has really gone backwards. They've closed bars and indoor seating in restaurants, which I think will hopefully eliminate some of that risk of spread. We're learning more about this disease week to week and day to day. So what I say today may change in 24 hours, and we sort of always have to preface that. But what we're learning is that the real risk is large groups of people indoors, not wearing face coverings, not social distancing, where there's opportunity for that easy spread.
And we haven't talked about the contaminated surfaces. How has our thinking on that changed at all over the past 4 months?
The primary cause of mode of transmission is going to be the droplets. It's possible that surfaces are going to transmit disease, COVID-19. So the hand washing is going to be really critical. High touch areas should be cleaned and disinfected regularly to minimize spread, to limit spread. So those things haven't changed, but I think it's far more likely that you're going to contract COVID through the droplets in the air if you're not socially distanced.
Great. Ryan, is there anything you want to add for the community's benefit?
I can't reiterate enough how important it is to take action today to minimize spread for the future. We want to continue in phase 3. We want to feel safer. We're not going to be 100% safe from COVID-19 for a while, but we want to feel safer as we bring our children back to school, as we reopen, as students come back. And so to do that, it's really up to the individual to make sure that we're adhering to the guidance. Face coverings are critical in minimizing spread, especially when you're indoors. outdoors when you're not able to socially distance. And when related to the contact tracing, so I think one thing that's come up, not necessarily in Virginia, but when we call, we're doing this as a way to minimize spread. We're not sharing private information. We're not really looking to do anything other than make sure that there's understanding about the disease, what an individual's risk is, and what they can do to help themselves and help their community.
Yep. If you want to learn more, if you want to get access to the data that we've got from the health district, you can go to charlottesville.gov/coronavirus, and you can see that same dashboard that we were going through at the top of the program. I want to thank all of the audience members who participated, especially via Facebook today, and to my staff for capturing their questions. I appreciate that. And let you know that we'll be back again in 1 week on Tuesday, July 14th. And if you've got ideas about feedback for the show, or you have questions, topics, and suggestions for future guests, please contact me and let me know. Thank you for watching, and please stay healthy.